Hi, and welcome to BDAP 101. This is an overview of the Ryan White Part B Benefits and Drug Assistance Program here in Iowa. My name is Brittany Keel, and I'm the Ryan White Benefits Coordinator here at the Iowa Department of Health and Human Services. Today in Module 1, we will be going over the structure here at Iowa HHS and how the BDAP program fills in the state of Iowa. To begin, the Iowa Ryan White Part B grant comes from the federal government and is distributed down here at the state level through Iowa HHS. As part of the Ryan White Part B program, we really have two arms of services. One is client services, and hopefully you've already gone through Client Services 101, but Client Services really oversees the case management program and core medical and support services. So think about the housing, the transportation, the food assistance that you're providing to your clients. All of that goes through Client Services. Not everybody who's enrolled in client services will be enrolled in BDAP. Some of those folks don't have a need for the BDAP, but the other arm of programming that we have here under the Ryan White Part B program is the BDAP, where we're providing medications and benefit coordination for our folks throughout the state of Iowa. The Ryan White Part B program is nestled in the Bureau of HIV, STI, and Hepatitis here at Iowa HHS. So I wanted to give you a sense of where the Ryan White program fits in, and in particular where the BDAP fits in. And so here you can see the Bureau of HIV, STI, and Hepatitis. We report to our Bureau Chief. And here under HIV and Hepatitis, programming are the Ryan White Care Program. We of course have our program manager, client services coordinators, quality coordinators, data coordinators, and then our benefits coordinators. And here on the next slide, I will show you, kind of introduce you to some of these folks. So you can put a face with a name. The Bureau of HIV, STI, and Hepatitis is led by Chief Biz McChesney, and the HIV and Hepatitis section is led by Holly Hansen, who spent the last 20 years as the Ryan White Part B program manager. So this is a new role for her, and we're very excited about her new leadership opportunity. Currently, we have a vacancy for the Ryan White Part B program manager with Holly Hansen's transition to the HIV and hepatitis section supervisor. And then, of course, I'm Brittany Keel, and I'm the Ryan White benefits coordinator. My team also has Roxana Ferrero and Dina Telenar. Both of them are Ryan White benefits and enrollment specialists. So you'll be working very closely with them to submit applications and make sure that clients are getting everything that they need from the BDAP. Also on our team, if you haven't met them yet, there's Megan Guthrie and Casey Ward. Both of them are Ryan White Client Services coordinators. We also have Mariah Karamuna and Denise Montgomery, who are the Ryan White Data and Ryan White Quality coordinators, respectively. And also we have Cassie Welsh, who's our behavioral health coordinator, and Christina Abdallah, who is our Ryan White intern. And I'm super thrilled to say that she'll be staying on for the foreseeable future. I also wanted to introduce you to New Cara Pharmacy. So we utilize New Cara Specialty Pharmacy for all of our clients' medications who are enrolled on the Benefit and Drug Assistance Program. So we authorize New Cara to fill one 30-day supply of medications to clients each month. If clients are local to the Des Moines area, they can pick up in person if they would prefer. Medications can also be mailed to your agency if a client would prefer to have them mailed to your clinic versus having it delivered to their home. New Cara's process is that they reach out to the client about 21 to 23 days after their last fill to assess if they are ready for a refill. And they can do that via text, email, or phone call, whatever the client would prefer. I've included NuCare's contact information for you, their phone number and their email address. You will sometimes be getting emails from NuCare, so be sure that you add them to your trusted senders list. I also wanted to make a note about mailing medications out of state. We are not allowed by law to mail medications out of the state of Iowa. It is illegal for NuCare to mail meds to a state that they are not licensed in because it is illegal for anyone who's not registered with the DEA in that state to mail out medications. So with that in mind, we please would encourage you to let clients know that they cannot receive their medications from NuCare if they say go to Florida on vacation, or if they're going to go back home to like a country of origin and they'll be there for 3 or 4 months. We ask that they would let you know well in advance so that we could provide them with multiple months worth of medications prior to their travel, because once they leave the state of Iowa, we're not able to mail those medications to them. I also wanted to review how you can contact us here at the BDAP. I've listed my phone number along with Roxana and Dina's phone numbers for you. We have a shared email, and so we would ask whenever you have BDAP specific questions to please email us at bdap@hhs.iowa.gov. If you need to contact one of us over phone, maybe something is a little time sensitive or something is you're not comfortable putting in an email, I would ask that you please call Roxana or Dina first for BDAP eligibility questions. Those gals are the ones working in applications every single day determining eligibility, and so they're really going to be your best source of knowledge for questions related to eligibility or application submission. Although I'm super thrilled to talk to you anytime you want to give me a call, those gals really are the experts on applications. So if you are submitting an application and it's urgent, needs processing right away, please indicate that to us in our REMI system, which hopefully you're somewhat familiar with at this point. And you can send us an email to let us know, and we will prioritize the application to the best of our ability. It's very rare that we don't get to an application the same day it is submitted, but occasionally we may all be in an all-day meeting or offsite or traveling. And so with that in mind, we would like for you to let us know that you have an application that you would like processed as soon as possible. When you're emailing us here at the BDAP, I've got a list of do's and don'ts. So under the do column, please include the client's ADAP ID in the subject line. So in REMI, you'll see that the client has an ADAP ID. We have not changed that to say BDAP ID. Our program used to be known as the ADAP, and now it is the BDAP, but please continue to use that ADAP ID. If a client has not yet been assigned an ADAP ID, you may use the client's ID. If your agency does not have a client ID, please send the email securely. We do ask that whenever possible, please avoid sending us secure emails. The reason for this is because secure emails tend to expire and they're really hard to track after that has expired. So if we've been working on an issue for the last 6 months with the client, maybe, going back and forth with a Medicaid decision or something along those lines, we will lose track of the progress of that issue when a secure email expires. So we would just ask that if you can avoid sending us a secure email, please do that. And we would also, on that same vein, ask that you email our shared email, that bdap@hhs.iowa.gov, rather than emailing Roxana or Dina or myself directly. And this is really because we want to be able to track the issue, and also if one of us is out for an extended period of time, we would be able to pick up right where the other person left off and see what they have already advised you. If you're not sure how to send a secure email, please contact your agency's IT for support with that. And so those are all of our do's. And when it comes to do's, you also have some don'ts. And in the don't column, when you email us, we ask that you do not put identifying information in an email unless you are sending it securely. So names, birthdays, initials, all of those are considered identifying information and need to be sent securely. Please do not put client identifying information in the subject line, even if you're sending it securely. So please do not title an email John Smith or title an email JS or use their date of birth. Emails are considered subject to the Freedom of Information Act, and we do not want to out anybody's status unnecessarily. And please do not hesitate to reach out to us. We are staffed from 8 a.m. to 5 p.m. Monday through Friday. There are a couple of days in which Roxana and Dina are working at the Lucas State Office building, and they tend to get there a little bit earlier. So that is 8 to 5 is kind of our general availability, but sometimes we tend to be available before that as well. If you need technical support, so you're having issues with REMI or with Careware, please contact the Ryan White Data Help Team. They're going to be your best bet for all things related to the systems that we use. They can also assist you with deleting any forms that you might have created by accident. So let's say you started an ADAP application, but that person's not going to enroll. They're able to delete that form for you. So getting into a little bit of the nitty-gritty, I want to talk about Ryan White and BDAP overview, kind of from a general lens, and then we'll get more specific to what it looks like here in Iowa. There are different parts of Ryan White, and so I've mentioned a lot about Ryan White Part B, but just to give you a sense, Ryan White Part A, it provides emergency relief to metropolitan areas that are disproportionately affected by HIV. So we do not receive Part A here in the state of Iowa, but our friends in Illinois receive Part A in the city of Chicago, some of those really big metropolitan areas. So think Phoenix, Los Angeles, San Francisco, New York, Chicago, Miami, those places are going to be receiving Part A funding. Part B funding then is designed to assist states and territories improving the quality, availability, and organization of healthcare and support services for individuals and families living with HIV. So that's where we get our case management, that's where we get our medical bill support, transportation, housing, but it's also where we get assistance for needed pharmaceuticals through the federal program known as the AIDS Drug Assistance Program, or ADAP. Of course, here in the state of Iowa, we call it BDAP, and I'll get into that a little bit more later. There's also Ryan White Part C, so some of you are probably familiar if you're co-located at a clinic that you get some Part C services that provide support for early intervention and primary care services for people with HIV. Some of you might also be getting Part D, which enhances access to comprehensive care for children, youth, women, and their families with or at risk for HIV. And then there is also a Part F, which provides funds for special projects of national significance, or SPINs. It also funds the AIDS education and training centers, dental programs, and the Minority AIDS Initiative. In Iowa, we partner with Minnesota Maytech, and so that is the Midwest AIDS Training and Education Center. We don't have our own Maytech in Iowa. We utilize our friends in Minnesota for their knowledge and expertise. So those are the parts of Ryan White in a nutshell. At a glance, I wanted to provide you with a map of what Ryan White services look like here in the state of Iowa. So Iowa is somewhat unique in that there's no really one densely populated area of the state. So while maybe the majority of the folks live in this Polk County area in Des Moines, you can see that we have different pockets of really population where we're providing Ryan White services. So starting on the western side of the state, serving the Potawatomi County and the southwest Iowa region is the Nebraska AIDS Project, and they are a Part B enrollment site, but we also have the University of Nebraska Medical Center, or Nebraska Medicine, that has a Part C clinic serving some of our folks that live in the southwest Iowa area. Moving north, we've got the Siouxland Community Health Center. They have both a Part B and Part C clinic. And then moving to the middle, up towards the Minnesota border, is the Northern Iowa Community Action Organization, also known as NICO. They're there in Mason City, and they're just a Part B enrollment. We also have the Cedar AIDS Support System, or CAS, that's located there in Waterloo and Black Hawk County. And then on the eastern side of the state, we have the Dubuque Visiting Nurse Association, located here in the city of Dubuque in Dubuque County. We also have Lynn County Community Services, which of course is located in Lynn County or Cedar Rapids. The Project of the Quad Cities is another one of those agencies that has clients on both the Iowa and Illinois side, like NAP has Nebraska and Iowa side, and they're really close to the Genesis Medical Center in Moline, Illinois. We also have the University of Iowa in Iowa City that has both Part B and Part C. They subcontract with River Hills Community Health Center in Ottumwa. And then last but not least, we have the Project of Primary Healthcare that also has a Part B and Part C clinic. And we have one case manager that serves the folks of Ames in Story County. So you can see we have lots of different sites here in the state of Iowa, and you'll get to know your colleagues throughout the year at some other networking opportunities. Very briefly, to highlight some of the things about the Ryan White Part B program in Iowa. In 2022, we had approximately 3,500 to 3,600 Iowans living with HIV, and about 2,300 of those folks were receiving a Ryan White Part B service that year. About 74% of Iowans who are diagnosed and living with HIV received a Part B service in 2022, and 28% of those folks received a BDAP service. So while I talk about how Part B is so much bigger than BDAP, our focus, of course, is on the BDAP and is on this 28% of those clients who are receiving a service. Another thing that we are really proud of here in Iowa is that we lead the nation in viral suppression. So you can see here in Iowa in 2021, we led the nation with an 81.7% viral suppression, and the national average was 65.9%. So we're well above the national average. The next closest jurisdiction is Montana. But you can see how well we fare compared to just our neighbors. So Nebraska, Illinois, Missouri, Wisconsin, Minnesota, we are leaps and bounds ahead of them. And while we're super happy to brag about this, this is truly a reflection of the work that you do every single day with clients, helping make sure that they get access to medical care, to their medications, to insurance. This is all a testament of your hard work. Viral suppression is the best marker of successful treatment in reducing the amount of HIV that's in the blood and elsewhere in the body to very low levels. The goal of HIV treatment is to, of course, improve health outcomes and prevent the transmission of HIV. And in Iowa, we are very, very happy and proud that those who are diagnosed with HIV and engage in our case management services are more likely to achieve viral suppression than those who do not. And so you can see at this chart on the left here that of those living with HIV that are enrolled in our Ryan White Part B case management program, who may or may not be accessing the BDAP, they're achieving viral suppression 91% of the time, compared to their counterparts who are not enrolled in case management. They're achieving viral suppression 71% of the time. And the national target is that 90% of people living with HIV would achieve viral suppression. And so we are beating that mark by 1% and are super proud to say that. And that is a direct result of all of the hard work you're doing as direct service providers to people living with HIV. And where we happen to see the biggest difference in these outcomes are among our disproportionately affected population. So case management services have a strong impact on viral suppression among Black and African American and Latino Iowans who were diagnosed and living with HIV, especially among non-US born populations. So I know there's a lot going on in this chart, and I just want to break it down for you to say that folks that are receiving a BDAP or enrolled in our Ryan White Part B program are achieving viral suppression more than folks who are not. So here among US born Black and African American, when they're enrolled in case management, they achieve viral suppression 86% of the time. And when they're not, they achieve viral suppression 59% of the time. Compare that to our non-US born Black and African American populations. When they're enrolled in case management, they achieve viral suppression 88% of the time compared to 46% of the time when they are not enrolled. And again, looking at our Latino population, those who are born here in the United States that are Latino achieve viral suppression 92% of the time compared to 74% of the time. And even more drastically, when they're non-US born Latino, they achieve viral suppression 94% of the time versus 35% of the time when they're not enrolled in case management. So we love to brag about this slide and show people all the incredible work that we're doing. But again, this is you. This is your everyday building relationships with clients, getting them connected to programs like the BDAP that can support them. And finally, in this section, I just want to talk about the structure of BDAP and a little bit of the history of the Iowa BDAP. So really what BDAP is, the Benefits and Drug Assistance Program, is a statewide federally funded prescription medication program for low-income people living with HIV. This program provides access to medications to eligible clients either directly or by purchasing health insurance that includes coverage for HIV medications. Here in Iowa, clients are eligible for the program if they are HIV positive, they are receiving HIV medication, they have an income at or below 500% of the federal poverty level, and they are uninsured or do not have adequate prescription coverage. To receive BDAP, clients must enroll into case management at one of our Ryan White Part B agencies throughout the state of Iowa, and the clients will then provide their eligibility documents to you, their case manager, and you will submit the application for services on their behalf. Once enrolled in the BDAP, clients are responsible for informing their case manager of any changes to their income or residency status, and clients need to enroll in the BDAP program every 12 months by submitting all of the required documents, which is what we'll be spending a lot of time in the consequent modules discussing. A brief history of the evolution of BDAP is that in the 1990s, the Ryan White Care Program was passed, and when the ADAP initially launched, there was truly an emphasis on obtaining medications only. And so you're thinking the early days of the AIDS epidemic where folks were going to be prescribed AZT. This medication was incredibly expensive. Not everybody was a good candidate for it. So in the 90s, there was really a focus on just getting medication to people and not worrying about insurance or how you could generate, income for a Ryan White program from folks. So in 2010, we had the Affordable Care Act passed. The ACA said that those living with HIV could finally obtain private health insurance coverage without being denied or without being charged additional fees for being HIV positive. So the Affordable Care Act was a huge undertaking, was passed in 2010. Parts of it were not implemented until 2013. And at that point, we realized this is going to require some really highly technical skills for enrollment and eligibility. This is going to open up a lot more opportunity beyond what the BDAP or the Ryan White program could take on capacity-wise at the state. So we created positions known as field benefit specialists in 2014. And so most of your agencies should have an FBS there, and we rely on them to help with insurance coordination and benefits all the time. In 2016, we changed our FPL requirements to both 400% for both medication and insurance assistance. Previously, Iowa, along with a lot of other states, said you could only be at 200% if you were uninsured, but 400% if you were insured. But we changed that, so in 2016, it was 400% for both programs. In the following year, we adopted an open formulary, which means that we cover most medications that are medically necessary at no cost to the client. In 2022, we increased our FPL for all of our programs to 500%, which opened options to more low-income Iowans living with HIV. And in 2023, we made the change from being called the AIDS Drug Assistance Program to the Benefits and Drug Assistance Program so that we could reduce stigma and better align our efforts on benefit coordination. Which leads us to today, which is that our focus now is to enroll clients into the best benefit home based on their individual needs. Very briefly, I want to discuss discounts and program income, which I mentioned kind of previously in the previous slide. So because we're a state ADAP, we are entitled to purchase HIV medications and other medications at a highly discounted rate. And then we can use the difference to put money back into our program. So the way that this works is, let's say that the cost of an HIV drug is $1,000. Because we're a state ADAP, we can purchase that medication at a highly discounted price. That discount is called 340B. And let's say that we're able to purchase it for $500. So it costs the ADAP $500 to buy a drug that would normally cost $1,000. What we can do then is Nucara is able to then bill the insurance for someone who's insured for the whole cost of the medication, and the insurance company has agreed to pay $2,000 for the cost of that medication. So the difference between what the insurance paid and what the BDAP paid then becomes income belonging to the BDAP. So in this circumstance, we would pocket like $1,500 in that case, and that is what is called program income. Program income is then used to fund positions at your agency, at the state. We could roll that money into housing, we can roll that money into transportation, core medical support services, anything that will really truly help the program be sustainable. And I don't expect you to remember all of this or to reference this a lot. I just like to let you know that this is the model that we operate under. And within the BDAP, we have 3 different programs. One is our medication assistance program. This provides discounted medications to uninsured or non-covered clients. So these are clients that don't have insurance. These are clients who are categorically ineligible for Medicare or Medicaid. These are clients who have applied for Medicaid and are awaiting a decision but need meds in the meantime, or clients who are in between insurance plans. So let's say a client left their job, they won't have insurance for 2 months, and so they just need help with their medication until their new job gives them insurance. We also have the insurance assistance program. This pays for eligible premiums, copays, coinsurance for prescriptions. So this is for clients who have Medicare Part D, who have a private insurance plan through their employer or maybe their spouse. This also covers people that have Medicaid for employed persons with disability, or the MEPD program, which we'll talk about a lot later, and then clients who are on the 5-year Medicaid ban. So when you emigrate into the United States, you are placed on a 5-year Medicaid ban, so you're not able to apply for Medicaid for the first 5 years that you're living in the United States. So in that case, we will enroll those folks onto our insurance assistance program and buy them insurance. We also have the jail assistance program, which Roxana oversees kind of the day-to-day and does the jail outreach there. This provides medications to persons who are living with HIV that are currently incarcerated in an Iowa county jail. So this is driven by the county jail, and the jail staff will apply. You will not apply on behalf. The jail needs to apply directly. We will communicate with you, however, if you have a client who is applying for the program, and the client does not necessarily need to be case managed. So if they do not have a case manager and they're applying for jail assistance, we will refer them to Ariel, who is our data services coordinator, and she'll be sure that they get a referral to one of your agencies at the time that they discharge from the jail. Generally speaking, to be eligible for the BDAP, I mentioned this a few slides ago, you have to be diagnosed with HIV, have an annual income at or below 500% of the federal poverty level, be a current resident of Iowa. You must have a viral load drawn within the last 12 months, and you must be case managed by a Ryan White Part B agency in Iowa. So we require proof of diagnosis at the time of enrollment, and it must show a detectable viral load. If you have trouble obtaining this proof, please give us a call, but I'll talk about these way more specifically and in greater detail in subsequent modules. Also a note that we have the Delta Dental program. So we process applications for the Ryan White Delta Dental program. The program is administered by Client Services, but BDAP processes applications, terminations, and payments. So when enrolling or terminating a client from Ryan White Delta Dental, you must CC us at the BDAP admin email. The enrollment process for the Benefit and Drug Assistance Program works like this. Step one is that the client completes an intake or a renewal with you, and you assess their eligibility for the program. So after you've collected their pay stubs and inputted their income information, Remy will tell you if the person's income eligible. And at that point, you would submit the application and the supporting documentation to us in Remy. We review the application, and if we approve it, the eligibility is conferred for 12 months. So Nucara at that point, if it's a brand new patient, they've never filled out Nucara before, they will complete a required medication counseling for that first fill. The required medication counseling is required by law and for their accreditation as a specialty pharmacy. So the client will only have to answer the intake questions one time. From that point on, medications will be mailed to the client monthly, and at 12 months, they will complete the intake and renewal process with you again. So if a client enrolls in August, their renewal month will always be August from that point on. If you're wondering what the BDAP pays for, we pay for medications, we pay for premiums for insurance plans that cover medications, and we pay for cost sharing on medications. We have an open formulary, as I mentioned before, which means that we pay for most medically necessary medications with a handful of exceptions that we call our exclusion list. Our exclusion list covers things that we're not allowed to pay for either by federal or state law or because of the mechanism of a mail order pharmacy. So some of the things that we do not cover are the abortion pill, acne medications, anti-rheumatic injectables because those are provider administered. There's no good way for us to be billed for those drugs. We don't cover blood sera, we don't cover Botox. Compound medications are covered, but we have to approve that before they're filled. We don't cover things that are considered cosmetic. We do not cover durable medical equipment. So if you needed a walker or a wheelchair or a glucose monitor, you could use other Ryan White funds to pay for that, but the BDAP is not allowed to pay for that. We do not cover erectile dysfunction medications or fertility medications, hair removal or hair growth meds, human growth hormone, hyaluronic acid derivatives, immune globulin IV. We do not cover infusions or injectable muscle relaxants. We do not cover most provider administered medications except for HIV medications that are administered injectably. We do not cover medical cannabidiol, and we do not cover Schedule II controlled substances or cough suppressants that contain those controlled substances, just because of the mail order model. And so if you have somebody that needs assistance with the Schedule II drugs, such as like Percocet or Adderall, you can fill at a local pharmacy or your clinic's pharmacy and use other Ryan White line items to pay for that. But the BDAP will not be paying for that at present, just because of the risk of it getting lost or stolen in the mail. I mentioned long-acting injectables. So if you have a client that's receiving a long-acting injectable, we would ask that once you receive the copay or the invoice from the client or the provider, you can send that to us for payment if the client's insured. If the client is uninsured, please contact us for next steps on how to obtain that injectable. The long-acting injectables are generally given once every 60 days in a provider's office. Sometimes it's every 30 days, and sometimes it could be every 6 months. Most of the time, though, these injectables are billed to a client's medical insurance rather than to their pharmacy benefit. So, for example, when you go to the doctor and you check in, you know that you're going to have a $15 copay. And if he prescribes you an antibiotic for your sinus infection, when you go to the pharmacy, you know you'll have a $30 copay on your antibiotics. What you don't know is that if the doctor were to order a strep test and administer a strep test to you, that would have to be sent off to your insurance. Your insurance would settle the claim with the provider's office, and then you may get a bill later on saying you owe $22 for the strep test. That is a similar function to the medical insurance piece for the injectables. So sometimes there could be a delay in getting those bills. And so a client may not know at the time that they fill their injectable that it's going to be a $300 copay or whatever the case is. And so there is that issue with we don't know in real time what that's going to cost, so there's no way for us to pay for it in real time. The Connect program that's offered by the drug manufacturer of Cabenuva only contracts with certain pharmacies and has no plans to add Nucara, so we're kind of stuck in that limbo for a while too. So all of this to say, if you have a long-acting injectable and you need some further guidance, please reach out to us. And one final note too is that we also cover hepatitis C medication. So I mentioned that we have an open formulary, but I wanted to make a specific note about hepatitis C meds because about 21% of the people that are living with HIV in the US also have hepatitis C. So infection with both is called a co-infection, and people with HIV and hepatitis C may be treated for both infections. So coverage for hepatitis C treatment should be submitted to any active insurance plans first. Generally speaking, insurance is covering it, but if the insurance were to deny it, the client could apply for medication assistance with BDAP to cover the cost. You just have to show us documentation that the Hep C coverage was denied or would be reasonably denied or not covered by the insurance. So be sure you include that information in the application. And as of October 1st of 2022, Iowa Medicaid no longer has a sobriety requirement. So for many years, Iowa Medicaid said that you would have to pass a drug test if you wanted to have your Hep C cured, but that is no longer the case, and Iowa Medicaid is covering hepatitis C medications more robustly than they were before.